Hi, I'm Nancy Szilagyi from Infection Prevention at Capital Health, and I'm here to tell you that SMART is knowing how to do proper hand hygiene. The CDC says the best way to prevent infection is to perform hand hygiene. There are two ways you can perform hand hygiene, with soap and water or an alcohol-based hand rub. And I would like to demonstrate to you first how to do hand hygiene using the soap and water method. First thing that you're going to do is belly up to the sink, and you're going to turn on the water to make sure that the temperature is not too hot or too cold. Once it's at that proper temperature for you, you're going to wet your hands up to your wrist. Next thing you're going to do is apply the hospital-approved soap. You're going to press once. It will dispense the adequate amount of soap that you need to do good hand hygiene. Now you're going to lather for 15 to 20 seconds. You're going to pay special attention to all surfaces of your hands, the tops of your hands, the palms. You want to go in between those web spaces, around your fingernails and your finger bits. You want to limit the use of tight-fitting jewelry and any kind of jewelry. Once you're done for 15 to 20 seconds, you want to point your hands down into the basin, run the water over them, take a paper towel, dry off your hands. Take that paper towel, pitch it in the garbage can. Now you'll take a second paper towel and turn off the faucets. Your hands were dirty when you first came in. Now they're clean, so you want to keep them clean as long as you possibly can. The second way that you can perform hand hygiene is with an alcohol-based hand rub. In order to use them, you simply have to go to the container, press the lever once, and it will dispense the exact amount of alcohol-based hand rub that you need to perform hand hygiene. You want to rub it, make sure that you cover all surfaces of your hand, again in between your web spaces of your finger, around your fingernails, and you want to rub this until your hands are dry. And then you're good to go. Remember not to rub your hands with the paper towel after you're done using the alcohol-based hand sanitizer, or to wash it off. Your hands now are clean and ready to go. There are 5 times when you absolutely must perform hand hygiene. Hand hygiene is to be done before patient contact, after patient contact, before you are doing any clean or sterile procedures, after you come in contact with the patient's blood or body fluid, and upon touching any of the environmental surfaces within the patient room. It's a safe bet to practice proper hand hygiene. And remember, safe is smart.
Hi, I'm Eric Scott. We're outside Capitol Health talking about hygiene and hand washing. And actually, we have someone now. Hi, what's your name? Where are you from?
I'm Scott Clemenson from Capitol Health. I'm the Vice President of Human Resources here.
Diseases. What would you say to your doctor or your healthcare professional if you saw them not washing their hands?
I would confront them and ask them to wash their hands. And I'd be concerned that they're passing germs on from another patient to me.
And what do you think? Does it make you want to wash your hands more?
Absolutely. I think working around a hospital particularly, we're a little bit more aware of that. So I am more conscious of washing my hands on a regular basis.
So what would you think if your healthcare provider was not washing their hands?
I would be very scared.
Has that ever happened? You ever said anything to them about it?
Yes, in doctor's offices when I've been there with my children to have them wash their hands.
So I want to show you something here. This is a picture of the bacteria on your hand. Which one is the unwashed hand, do you think? And this is a hand that was washed just 5 minutes earlier.
Yes.
What do you think about that?
I think everyone needs to wash their hands.
It's a little extra incentive. Let me show you this one. This is the scariest one that I saw. Doctor was looking at a patient that had MRSA. Did a physical examination. Right after the examination, touched that petri dish. That's the MRSA.
That is scary.
So I want to show you a couple of pictures here. So can you pick the washed hand and the unwashed hand?
That's the washed hand, that's the unwashed hand.
So you see all the bacteria that's on there.
Yes.
So let me show you this one. This is a doctor who had examined somebody with MRSA.
Okay.
Touched this petri dish. That's the MRSA infection after a short examination. And then the next petri dish, the one that's clean, that's the washed hand, right?
Right.
That's using an alcohol-based hand sanitizer
Okay.
right after the exam. Did you know that viruses that can survive on the skin can't survive just a simple hand washing?
Yes.
So you're pretty knowledgeable about this whole hand
Yes,
washing
I'm almost
thing.
like a germ freak.
Yeah, yeah, that's a good thing in a
Yes,
hospital.
it
It is a
is.
good
It
thing.
is.
Yeah,
It really is.
Absolutely. So tell me something that maybe I don't know about hand washing.
Do you know with the hand sanitizer you have to keep rubbing until it dries?
I did not know that.
See, there you go.
So now you're teaching me something.
I
and
am,
you
and
are
now
absolutely.
you can teach someone else.
Yeah, well, I want to thank you very much for your time, for answering our questions. Congratulations on washing your hands as much as you do. And as you continue your day here at Capitol Health, I want to give you a little bottle of hand wash.
Oh, wonderful.
You know, just in case you want to do it one more time.
Thank you.
Thank you very
All
much
right.
for your time. Thank you very much for your time. You're an expert on hand washing
Today, yes.
today, and I even learned something from you.
Yes, you
All right,
did.
so as you go back to work, here's a bottle of hand sanitizer
Thank
for you to
you.
use so you can continue to spread the word.
All right, thank you.
Thank you
Have a good
very
day.
much. I'm Eric Scott, and remember, it's a safe bet to practice proper hand hygiene, and safe is smart.